When I first was choosing a residency program, I chose it based on geography, where my family was.
Education, mentorship.
Opportunities to do research, a strong community network.
I wanted to make sure that the residents were really well taken care of.
I fell in love with Stony Brook my interview day. It was very clear that all of the residents loved being here.
Within the Stony Brook Health System is Stony Brook University Hospital, a 624-bed, level 1 trauma center, level 1 stroke center, level 1 myocardial infarction center. We have all of the specialties that anyone could possibly need for clinical care.
One of the biggest distinctions that I saw was the variety of cases and patients that you see here. And I had rotated at city programs, and I had noticed that they didn't have that exposure that you have here. Most residents in orthopedics end up going to other hospitals to get that experience. If you stay here, you can get all the exposure you would need, and that includes high energy trauma, which is also something you wouldn't see in a city program.
The community we serve is a very large community. We have a very large catchment of patients. They come from all walks of life, different diversities, different socioeconomic status, different ethnicities.
It's been very good, not just for us to work with a diverse patient group, but also for the patients themselves to be able to work with a diverse group of physicians. I have worked with patients that the minute I'm able to speak to them in Spanish, they feel just much more comfortable in being able to talk about their ailments and their preoccupations and what they're worried about.
Because this is a tertiary care center, we not only take care of our community patients, but we have the privilege of taking care of patients from all over Eastern Long Island. And so what that means is our ICUs are oftentimes will have transfer patients who require a higher level of care, or we get the privilege of working with our critical care attendings to figure out what's going on.
We have our own EMS center here. Additionally, we have helicopter services that come to our hospital from patients from all over Long Island and the surrounding area. So Stony Brook is a really unique university hospital. We're a large academic medical center.
We've been a HealthGrade's Top 100 hospital for several years in a row, with particular excellence in cardiac care and stroke care.
There's a lot of different residencies here at Stony Brook, which is why I loved it so much. And in part of anesthesia, our first year is internal medicine and it's surgery, so we get to know a lot of those specialties.
And a lot of these programs are really nationally ranked and led by educators who are nationally recognized for their skill in education.
As an internal medicine resident, we have a lot of exposure to various parts of the hospital, as well as different specialties, just because we all work together.
As an orthopedic resident here, you get trained in everything. You get trained in joint replacement, you get trained in sports, you get trained in spine and pediatrics, you get trained in hand, foot and ankle, tumor.
It's a teamwork-based approach to medicine, whether you're in the emergency department, whether you're in the ICUs, whether you're on the floors, you always have someone to talk to, whether it's a faculty member or another resident. It's a constant learning environment, and that's really amazing.
In terms of teaching, we have a very large residency program, not just internal medicine, but we also rotate with emergency medicine, anesthesiology, psychiatry, and you get different residents, different backgrounds, different everything, and pass on your knowledge. As simple as it might be, but just to know that you taught somebody something is very rewarding as a physician.
We have an environment that really engenders a lot of interaction, and so what was nice about when I came is that it was part of a big initiative. It's very forward thinking for the institution, so we have big goals, we have big strategic plans, and we've been acting on them.
We constructed a near $500 million project here on the Stony Brook campus. It expanded our hospital, it built a devoted children's hospital, and it created a building we call the Medicine and Research Translation Building, designed for education, and it's designed for world-class research.
First of all, it's a beautiful hospital. We opened up this new building in November of 2019, and it is extremely easy to get around in, very, very comfortable for the patients.
The new building we opened last year, I think it is a progressive step forward. We moved the pediatric center upstairs, and so it's a much more comfortable environment for children. Also, all of the surgical ICUs are moved into the new building, and so they're set up to be able to take care of critically ill patients.
One of the goals in the Cancer Center, which is also a goal in the Dean's office, is to create opportunities for our fellows and our residents to do research and to have that experience.
Stony Brook University is a leader in research, and any research project that you want to do can really be accommodated here.
We span disciplines here. We're very, very invested in cross-disciplinary translational research.
So the research offerings here are a great opportunity for the residents because it allows them to delve deeply into a problem and become experts in it. Particularly when you're earlier in your career, the understanding that you can gain expertise that nobody else has about your specialty because you've done the work is a very powerful thing.
From every part of the residency program, especially in internal medicine, we are encouraged to pursue research opportunities. A lot of attendings who will reach out to you and they'll offer you projects that they're currently working on. What that means is, there's a lot of people who are devoted to making you a better physician, and so you get the opportunity to publish into various journals, and that helps you when you're applying for fellowship or even just applying for a job directly out of residency.
There are research mentors in every single residency program and fellowship program. There's statisticians that you can talk to that can show you how to do data analysis.
We pay attention to the stress level that our residents are facing, and we intervene when we feel like there's a problem.
Within the residencies, we also have wellness activities that occur through different departments, but also outside of work too.
As stressful as it is to be a physician, in particular to be a physician in training, it's really wonderful to know that when you are out of the hospital and when you're not working, you have this beautiful environment to be in.
One of the nice things about being here is that you're an hour and a half from the city, and then you're 30 minutes away from rural farm town, it's cool. It's very nice.
I live in Port Jefferson. It's right next to the water, and it's about a 10-minute drive from the hospital. And so it's really convenient, and a lot of my co-residents live there. It's a great little town. It has a lot of little restaurants. It's really cute in the summer, great sunsets.
It's just a lovely environment to come home to. I mean, after a stressful day at work, you just step outside and, from your door to the beach in 10 minutes. It's something you don't get everywhere in the U.S.
It's a wonderful place for families. I mean, really the education, but also the outdoors.
We also have a lot of good sports teams to visit, and you get that undergrad feel, that collegiate community feel from Stony Brook in that regards. And that includes a lot of performance arts, which Stoller Center invites multitude of artists.
I think it's absolutely true that a happier physician is a better physician.
As a lifelong mentor of medical students, of residents, of fellows, and of graduate students, I can speak from personal knowledge that someone entering the field of medicine has about 137 different career trajectories they might follow. All of those career possibilities exist here at Stony Brook, and you couldn't find a nicer environment in which to learn and to practice.
You don't just have one mentor here. You have multiple people that are all sort of highlighting the path of your success by them literally coming in every single day and making a learning opportunity out of everything.
It's the people that make the place, and we have wonderful internationally renowned mentors here. And this provides us with first-class training.
So I think what's true of every training program at Stony Brook is that you learn great care from great teachers, and you yourself become a great physician.
People go above and beyond to take care of their patients and also take care of the residents and fellows here. It has been an amazing experience at Stony Brook.
They have a saying to have your cake and eat it too. I definitely think we have our cake and eat it here at Stony Brook.